Good morning, boys and girls. This is Kevin in Bloomington, Indiana. I did an It Gets Better video. Um, Now I'm going to do a Living with AIDS video. Um, I'm doing this because I feel there is a need still. The rise of new infection rates amongst teenagers is rising. It's becoming quite alarming. Also, there are those of you out there since the advent of erectile dysfunction drugs who are older and dating, we'll say, who don't believe that they are at risk, and they are. Everybody who has sex unprotected is at risk. If you are having sex unprotected, please protect yourself. That's as simple as that. Wear a condom. Use dental dams. There are vaginal condoms for women, although I understand they are a bit uncomfortable. Um, there is no such thing as a condom that is too small for a man. Gentlemen, get over yourselves. You are not that kind of man. You are just a man. Condoms will fit you. Make it become part of foreplay. Let it be fun. Whatever. Anyway, I've been diagnosed with AIDS since 1992. I'm considered a long-term survivor. I believe I was infected in 1990, possibly early 91. Um, I am healthy now. And yes, there are drugs, which poses another problem. People nowadays, especially the youth of today, since the CDC has categorized HIV and AIDS as chronically manageable, um, they believe that if, so what? If I catch it, I'll take a pill, take two pills, whatever, I'll be fine. This is not the case. These pills that you take, they cause excruciating pain, they cause bloody diarrhea, they cause bone and joint deterioration. I already have a partial hip replacement. I'm 46 years old. And I'm going to have the rest of that hip replaced sometime within the next 5 years, and then somewhere within the next 5 years after that, I'm going to have my right hip replaced. Um, and it's just due to the meds and or the disease itself. Anyway, what I'm going to do today is I'm going to take you through my medicine. Those couple of pills that magically make everything all sunny and bright and sunshiny and gay. Not necessarily gay, but I'm gay. But anyway, so here we go. First up, we're going to start with my HIV medications. Um, I'm going to start with this lovely little pill right here. This is called a Viriad. Let's get a nice close look up. I don't know if you can see the color or not. It's kind of actually more of a pastel blue, but my blue on the shirt. And of course the piercing blue in my eyes. I don't know if you can see those or not, but it's nice and blue. Very pretty. Anyway, this is a nucleoside reverse transcriptase inhibitor. Don't know what that means? Look it up. It's also called an antiretroviral. This is only one of two that I can take. The other one, there's another one that I can take. I won't mention it by name, but it causes extreme neuropathy in my case. The second HIV medication I have is these two lovely beauties. These are protease inhibitors. It is a combination of two protease inhibitors. How do I like... Anyway, they're giant and they're yellow. And, and it's called Calidra. They contain ritonavir and lopinavir, both of which are protease inhibitors. If you don't know what a protease inhibitor is, look it up. These are my HIV medications. Now, at night, I also have to take, instead of taking the Viriad, which is the nuke, as we call them, the NRTI, I have to take Sestiva, which is a non-nucleoside reverse transcriptase inhibitor. Don't know what that means? Look it up. Um, so that's a change for the nighttime meds. Now we're going to take my what we call prophylaxis medication. This is to keep me from developing opportunistic infections. First step is my antibiotic, and that is this lovely pill. And of course, it is giant, of course, and it is called Bactrim. It's a broad spectrum respiratory antibiotic, or basically respiratory. They use it for other things as well. But I have a history of pneumocystis carinii pneumonia. This is to help keep that from flaring back up. Now, since I've been on the antibiotic for a long time, that causes what is known as the intestinal flora in my system to go out of whack. And since I've been relying on antibiotics, I now have to take an antifungal as well to um, balance that, I guess you would say, so that my body will work better. My antifungal is this lovely little pink pill. You can't really see the pinkness of it, but it matches the pinkness of my, I don't know, can't say virgin anything because not happening. Anyway, it's called diflucan. Actually, it's a generic version. Again, antifungal, don't know what it means. Antifungal, kind of self-explanatory. And then I also had to take an, oh wait. Okay, that's the prophylaxis drugs. Now we're on to side effect drugs. Drugs I take to counteract the side effects of the medications that I'm already taking. Ha 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 ha. Here is a little teeny tiny white pill. Little teeny tiny white pill. That is called Lamodal. It is an anti-diarrheal. Self-explanatory, and also, quite frankly, my drug of choice. Um, this capsule is called Cymbalta. It is an antidepressant. It's also called a norepinephrine and serotonin inhibitor. It helps my chemicals in my brain keep me from killing other people and myself. Thus far, ain't promising nothing. Um, this is a little capsule. It's called a Kebra. This is my anti-seizure. I had a grand mal seizure a few years ago, and since then I've been taking an anti-seizure. Good thing about this is it is taken with, it is processed through the kidneys, not the liver. Everything else is processed by the exact same enzyme in the liver, which processes also street drugs, etc., 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 and can cause higher concentrations or lower concentrations depending on what you're taking. So be careful when you're mixing meds with party. Not judging, just saying. Um, and then we also have the drugs to, oh, wait, gotta mention this one. I don't know if this is HIV related or not. All I know is my thyroid is not acting correctly, so I'm now hypothyroidic. And so I have to take this little pill. It is called Synthroid. It's a synthetic thyroid hormone. Um, this pill is a 10 milligram Valium. Self-explanatory, anti-anxiety. This pill, or capsule I should say, is Nexium. It is known as an acid blocker or an acid reducer perhaps. Um, and then there's also the last thing, ibuprofen. This is for my general aches and pains, my muscle aches, my bone aching, my inflammatory issues basically is what this is for. Plus I do get headaches just, thinking about all the crap I have to go through. So, we put those all in my hand. See? All in my hand. Yay. And then we put it in my mouth. Yes, that's right. Stick it in my mouth. and then you swallow. You have to shake around a little bit, right, right at that moment, right before you swallow, but you know what I mean. Anyway, that's the couple of pills that you have to take. I have to do that every morning, and I have to do the same thing every night. It's not as easy as it sounds, and every time you do it, you remind yourself that you are under the control, basically, of this disease. So don't get this disease. It's that simple. You can prevent it. You are the only one who can prevent it. Trust no one except yourself. That ends the lesson. And thanks for listening. Bye bye.